everyone. My name is Carissa Brewster, writer for Whitman Partners. And this month we are celebrating our perioperative power list for 2023. And today we have Lynn Wyllie, who is the VP of Perioperative at CHRISTUS Health System in Texas. Welcome, Lynn.
Thank you. Glad to be here.
You're welcome.
Obviously, that is a huge issue in healthcare across the nation right now. We were tasked with a couple months ago with eliminating all of our contract labor, which, as you know, that most organizations are relying heavily on contract labor right now to staff. So we were able to get rid of all of our contract labor here in Tyler in the last month, which some of the ways that we were able to do that within the organization is really to offer competitive wages and sign-on bonuses to new associates coming into the system, but as well as rewarding our existing associates. So we offered contracts for picking up additional shifts to our own associates to try to take some of that money we would be paying to contract staff to our own associates. So they had to work more than they would be normally scheduled for in order to be eligible for those type of incentives and sign what we called a seasonal contract. And that was very helpful for us to kind of, reward them and let them know that we appreciate them too, rather than paying a lot of money to a lot of contract labor. So that has also been helpful. In the operating room, which is specific to us, we made it through the whole pandemic without contract labor at all in any of my 11 perioperative areas, which was tough, but we did it through a lot of shift incentives. We train our own. We have two colleges here in town, a university and then a junior college that has nursing schools. We partner heavily with them. There's also a scrub tech school in town, and those students do their clinical here at our hospital. So then we're able to hire them prior to graduation. So the whole time they're here doing clinical, it's kind of like an on-the-job interview where we're seeing, what they're going to be a good fit for us. So we've been blessed to be able to have that partnership with the schools. Any nurse that comes into the operating room without operating room experience, regardless if maybe they've been a seasoned nurse on the floor for a number of years, if they don't have OR experience, they have to go through our Periop 101 residency. So that's curriculum from AORN based on their Periop 101 module. And then we have my perioperative educator is actually a facilitator for that course. So she teaches multiple cohorts of that throughout the year. And that's basically our pipeline for getting new nurses. We're basically growing our own. And we've been so far very, very lucky, even with a lot of growth, to be able to attract people to come here and stay here with being able to offer the competitive wages and those burst incentives. We do a lot of shift incentives where maybe we just need someone to stay a couple hours and we're able to incentivize them to do that through what I call burst incentives.
That's really lucky that you're able to partner with educational organizations in your town.
Yeah, that helps. We have a competing hospital that is literally across the street from us. We can walk out the door and there's another large healthcare center. So the schools try to stay up with being the pipeline for both those hospitals, which can be difficult at times. But yes, it has been a great partnership with those schools. Well, I wouldn't say necessarily shocking. I was an associate VP for a while prior to that. But one of the things, so CHRISTUS is a corporation, which we call our hospitals ministries because we're a faith-based organization. But there are 36 ministries within CHRISTUS, even in Latin America. So we're very big. So we're working for a corporation. And I had the opportunity when I was promoted to the VP level to engage, with a lot of executives at the system office. And that level of support was very surprising to me because you just think those C-suite, individuals may not want to have that interaction, at the local level, but really that upper level, senior level support has just been amazing to me, and the opportunities that they've given me to grow within the organization.
Yeah, it sounds like, mentoring is, I guess it's kind of spotty. Sometimes you kind of have to grow your own relationships. But yeah, once you get to the higher levels, you think people would just kind of do their own thing and not even think about you. But that's awesome.
Yeah, it is. That was probably a good shock, but one of the most surprising things.
Yeah.
But a positive one for sure. So I'll kind of answer that in two different parts. So one of the things that Christus Health offers is what's called a Leadership and Ethics Academy. So every 2 years, the president of each hospital within all the 36 hospitals within Christus, they nominate a leader from their hospital that can apply to be accepted into this academy. And I was actually in the academy last year. So, what that gave me the opportunity to do is for 1 year to travel to multiple Christus ministries, even in Latin America. And during those week-long sessions, a lot of networking, which is good, but also educational offerings were given to us on leadership development, diversity, just a number of key leadership areas. But part of that, I got to have an executive coach for a year, and it was outstanding. Part of our whole academy was we were doing a group project at the end within, each hospital that was something that our system CEO had asked, which would be an improvement. So we were doing a project around opening the doors from COVID to surgery, like to get back to those pre-surgical volumes, prior to COVID where we were, plus 5%, because he didn't want us to just have, an easy task. He wanted us to have a little stretch goal there as well, which we well exceeded it. But that executive coach helped with the project. I was an associate vice president at the time, and she actually helped me write my job description to become a vice president. So I would highly recommend the executive coach, and she's actually remains a friend of mine. You become friends with the person, and she came to our graduation from the academy, and I got to meet her in person. It was mostly, virtual meetings prior to that. As far as me mentoring people, we do offer a leadership mentorship within our organization. It's called the RISE program. And I have mentored a number of leaders where they also have to do a project and things like that and spend a certain amount of time with the leader in the organization. And they shadow you and going to different high-level meetings and help with budgeting and things like that. Kind of you determine what their goal is and then help them, get there.
Yeah, that sounds all very organized. I'm
Yeah.
pleasantly surprised.
Yeah, it was a great program. It was
Yeah.
really fun. At first, it's a pretty big commitment because every month you're
Mhm.
traveling somewhere for a week, and it's taking you away from your existing job, but definitely worth it. It was a great experience. I would say that I've always considered myself to be a transformational leader, and COVID really proved that because we've had to just adapt and overcome so much. An example I will give you: we were trying to keep surgeries going, even though we had mandates, from the state and things like that, but patients needed surgery, and we were trying to find ways to, switch a lot of our inpatient surgery that would require a precious resource, an inpatient bed that we really didn't have at the time, to outpatient. So actually, in one weekend, we took our surgery waiting room and turned it into a phase 2 recovery room with 10 beds. So that we could send total joints home and things like that same day. And we kept going. And really, it did just, everyone just came together as a team, and it really changed your leadership with all of my sites. I have an ASC, and I have another micro hospital that functions as an outpatient surgery area. And those departments, we shut them down, and that's hard, during that time to have conversations with staff about that. And we learned a lot from that because we always said then COVID round two, we knew with COVID round two, things to do differently. We have a plan, for what to do for those staff and where they can work so that we keep them working and things like that. But I think we all learned a lot from that unknown, and definitely being a leader, just, engaging your team and learning. I always said, we're going to adapt and overcome, adapt and overcome. That was kind of my mantra during the whole pandemic. And I think we did a lot of things that thinking outside of the box, and you never knew every day what you were coming into and what new mandates would be. But we kept going and we got through it. And I think we've learned a lot from it. I think it'll make everyone a better leader in the end from everything we've learned.
Yeah, totally. I mean, things just come up from left field. Like this past winter has been terrible for viruses that
Yeah.
aren't even COVID.
Yeah. Uh-huh. So that's a great question. So I have 11 departments, and 5 of those are offsite from our main campus. They're all within the same city, but in multiple locations. So a way that I've found to be able to get to those areas and be visible to those leaders and staff, I have one-on-one meetings with my leaders every month. So if they're at an offsite location, that meeting occurs at their location. So I come to them. So once a month I'm there and I meet with them, and then I'll round on the staff and be visible with them. And then in addition to that, I go to each department staff meeting once a quarter. And I try to time that around, we do quarterly employee engagement surveys. So I try to time that around when one of those has just ended and we have the results. And then I can go kind of talk to them about some key issues on there, and we can develop action plans and just kind of talk through. A lot of comments on employee engagement surveys right now are related to compensation. So it's good for me to get out there and just kind of chat with them about all the things we are doing for compensation that, they don't necessarily see. So those are ways that I'm visible in those locations, and I'll still go there more than once a month, if needed, just to, pop in and say hi, or of course, if something's going on at that location. But that guarantees that I'm going to be at that location at least once a month with seeing those people. So being in surgery, which is kind of the revenue engine of most organizations, is most, surgery departments produce about 63% of the revenue for the organization. We grew. Actually, we had surgical growth, growing. I always say volume solves all problems. So we focused on bringing in additional surgeons and things like that through recruitment. But something that's important in reducing costs, because I know that not everyone has the ability to just, we'll go hire five new surgeons and get some more surgeries to build revenue. And that's sometimes not realistic for all organizations. But I saw an interesting statistic that said that in the last 2 years, supply costs have grown 1,100%. So 1,100% supply costs have grown. And then revenue and reimbursement has obviously, been reduced. And contract labor prices have risen 543%. So I thought those were just fun stats to throw out there. But some of the things that we've done as far as supply costs is we are very compliant to our contracts with our group purchasing, with our GPO. So we're big, as an organization and a business, CHRISTUS Health is, so they're able to negotiate pretty good contracts for us if we're compliant with those contracts, which, 85% utilization and things like that. So getting the physicians on board to be compliant with those contracts and use those products is, oftentimes a challenge, but I found that just, being engaged with the chiefs of those service lines have really helped us to be able to lower our costs. We also have a local committee at our hospital called the Non-Labor Committee, which is a committee where multiple disciplines get together and we come up with cost savings measures that don't affect labor, because that's not, reducing staff or anything like that. And we all brainstorm. And so far this year, we've come up with 1.1 million in, non-labor cost initiatives. And I mean, some of it is the company that we use to shred the paper. Do we need to be having that many shredder bins? And it's just like a group that gets together once a month and brainstorms things like that. And really those things add up, over the year when you start looking at it. We had someone that came in and watered the plants, and we thought, does someone really need to do that? Couldn't we do it ourselves? I mean, just really, things like that, where you get a group of intelligent people together brainstorming, and you really come up, with some great things that do make an impact on the bottom line for sure.
Yeah, it's like all these little things that can save money that maybe were let go 5 years ago, and now it's like you can't let that go.
Right. Yeah, like you can't use the $12 pin, but we're gonna only allow you to order the one that's $2.
Exactly.
Just little things that people may not think of. I had a few. I couldn't narrow it down to just one, but really in the last year, our surgical volume at all my locations has grown 12%, which is huge with the current landscape of healthcare. So that's pretty exciting. We actually had one shelled out OR left. We have 27 ORs at our main campus. We finished that out last May. And I'm currently in the process of building 2 additional ORs with 7 pre-op and PACU bays on the 3rd floor of our hospital. We're on the 1st floor because we've hired 5 additional surgeons that are all going to start in August. So we have to have additional ORs. So I'm going through a construction expansion process right now, which is pretty exciting. And we just purchased an additional XI robot. So now we have 5 Da Vinci robots in our robotic fleet. So that's pretty exciting for our robotic program. And I also had the opportunity with our system office, they asked me to write a surgical playbook, which is basically how do you do things in surgery based on certain metrics and efficiencies in the operating room. So I did present that to all of the system chief medical officers and chief nursing officers in September at our system office in Dallas. And now that has been rolled out to all of the CHRISTUS hospitals to follow that for OR efficiency. CHRISTUS is calling this the year of the OR. And so we are really focusing on OR efficiency. So I've had the opportunity to lead that charge, and I go to other CHRISTUS hospitals and help them with their OR efficiencies. So that's been kind of fun. I get to go to some other ministries. I'm trying to say hospital, but we call them ministries within, the CHRISTUS network, and try to help them in areas that maybe they're not quite as efficient. But so the playbook was something that took a lot of time, but it's now on a SharePoint site within everyone can access that electronically, and they're asked to follow that to hit certain efficiency metrics, like first case on time stars, block utilization, the basic OR metrics that we all follow.
Yeah. Well, thank you for joining me. Thank you for, eking out time in your busy schedule. It was really nice to meet you.
Yeah, you too. Thank you.